Hi, I'm Dr. Jeffrey Antimarino from Bellissimo Plastic Surgery and Medispa. Welcome to Bellissimo Live. The amazing thing is that the technology for minimally invasive and non-invasive technology has improved tremendously over the last 3 to 4 years. So a lot of the devices that we had years before that are really just obsolete and just outdated by the newer equipment. So today we want to talk about really one area that's become very popular over the last few years for both men and women, and that is what we call the submental area, or this area just underneath, just above the neck and underneath the jawline. So we're going to take you through what your options are, not only non-invasive, minimally invasive, and surgical, depending upon what your goals are, what year you are in your life, what your goals are. So we're going to take you through that, and you're going to see years ago what your options were. I'll discuss that, and now all the options that you have. So let's start with a younger group, somebody in their 20s, early 30s. And again, this is for both men and women, and this has become very popular over the last several years. But a lot of patients will come in and they'll have a little bit of extra skin, or a little bit of extra tissue here, a little bit of fullness, a little bit of fatty tissue. A lot of it is hereditary. You're exercising, eating well, and you just can't seem to sculpt that area. You want to see more of your jawline. So what can we do? You have good skin tone, nothing else is working. So in the past, we had Kybella, and that's still available today. But Kybella, the limitations for that is that you could only treat this area here. You ended up getting a lot of swelling, and it was uncomfortable. So for us, it's sort of fallen, by the wayside. So what we've gone to now is a couple of different devices. So this one here to my right is Virtue, which is microneedling and radiofrequency. And there are a lot of devices that do that, and a lot of patients say, I've had microneedling in the past. This is different than regular just microneedling that you would get at a spa. This is a medical microneedling. It also combines radiofrequency. So the difference is these needles will actually penetrate deeper, so we can control the depth of the needles. And instead of being, at a depth of maybe 1 millimeter, these will go out to 3 millimeters. There's another handpiece we have that will actually go out to 6 millimeters. So really longer, much longer needles, and at the very end of it, it sends off a short radiofrequency wave, which causes heat. And what that does is it causes the collagen and the elastic properties in the skin to tighten and recoil, so we can tighten that skin. Also the depth of the needle will also penetrate into the fat underneath this area and actually cause the fat to dissolve. So one of the things that we can treat now in this area is the deep handpiece, this one here, which is brand new. It's only been out in the past year. And so we can treat this area, and it takes multiple stamping, and the whole procedure takes about 30 minutes, but you have to just topical numbing for about 40 minutes prior to that. So there's no anesthesia, you're awake through the whole thing. It's just some topical cream for about 40 minutes, then you do that treatment. You do this about one time every month for the first 3 months. We've seen some tremendous improvements in this area, what we would call minimally invasive. So depending upon what the goals are for the patient, that works very well. And again, this is a brand new handpiece. We've been using this device for other things, usually for texture, acne scars, surgical scars, tightening of the skin of the face for the last several years. It's really been a tremendous device. But now with the onset of this new handpiece, we're treating other areas, specifically here. We're also treating the arms, front of the thighs for ladies that are getting crepey skin. It works very well also. So that's one option that you have. The other option is the device to my left. So this is LipoAI. You've heard me talk about this in the past. This has been out now for about a year that we've been using it. It's still relatively new. Not many people know about this device. We were one of the first practices in the country to have it and to use it. But this uses laser lipo. So it takes a 2 millimeter incision, usually one incision right here, just a little stab, 2 millimeter incision right under the chin. No one can see it. And with the handpiece that's attached to it, I can actually use a laser under the skin. So it's minimally invasive again. And laser all of the fatty tissue underneath the skin. The heat also causes coagulation and the tightening of that collagen, just like this would, and help the skin to retract as well. So the laser will dissolve some of the fat and also treat the skin. Once I've treated that thoroughly with the laser, then I take that handpiece out and put in a small liposuction cannula and actually aspirate the fat. So that actually goes into a canister that we discard later. And I put one Steri-Strip over the incision. You wear some compression for a couple of weeks. That's it. So you usually have 2 to 3 days of downtime with this, and then you're back to work. I let patients start to back to exercising within a week or two. There really isn't any downtime with this. We ask you not to refrain from exercise for about 24 hours, just to let everything kind of settle down. But this one, you can go right back to work right afterwards the next day, and then start exercising in about 24 to 48 hours. With this one, we do have some serum that we have you put on for the first 4 or 5 days. After that, it's just regular lotion. With gentlemen, what I try to do is not have you shave for a couple of days. So it works really well. I've done this machine. It works really well. So I've had one good treatment of it. I have another one coming up in about 3 weeks. So I've seen some differences in the skin of my neck actually getting tighter. So I'm excited about it being, in my late 50s. So the other thing that this will treat is, you've heard me talk about buccal fat pad. This fat that lives right here in your cheek has become very popular again. So it kind of comes in favor and then goes out of favor over the years, but is back in favor now, especially for young women. They want to have that little bit of an indentation here to give a little bit more definition in the cheek. I'm not in favor of taking it out surgically, because you take out all of the fat pad. It looks good when you're in your 20s, but as we get older, you start to lose some fat in your face, and one of the areas you lose it is here. You can see on me, it becomes a little bit more hollow. So when the fat's not there, as you age, you can actually look more gaunt. So with this device, because we do it over time, we can actually treat this area with the same handpiece and take down that buccal fat pad slowly, so that we can gauge how much fat we remove, and we'll know how much fat is remaining, so that the aging process is more natural for you and you're not trying to do fat grafting in the future. So these two devices would work great for somebody in their 20s and 30s. The other option is to go to the operating room and do standard liposuction in this area, and I usually do that under IV sedation. So that is another viable option for patients, depending upon what you want. The nice thing about this, we do it in this room under oral sedation. At the end of the procedure, which takes about an hour, you basically get up, and with your driver, you can walk right out of the office. So no pain medicine is needed afterwards. Works really well. This one, you can drive yourself in, drive yourself home. So again, 3 options now that we can treat, when in the past you basically had Kybella, which was, again, only here, but you couldn't sculpt the jawline, so very limited, or surgery. So now let's go to the next age group. So now we have somebody that's coming in that has a little more neck laxity, a little bit of more skin laxity, a little less recoil, still some fatty tissue. What are your options? Again, at that point, we can go back and hit this device. Same thing, 40 minutes of topical numbing. The treatment takes about 30 minutes and you go home. The other option, again, is to do the LipoAI, because again, you can get some skin recoil and you can take out a little bit of the extra fat. So again, same downtime, virtually none, minimal downtime with this. The other option is to go to the operating room. So one other option that those patients have is sometimes you can start looking into a neck lift, and that's an incision along the bottom of the ear, circling behind the ear, and then out along the hairline on both sides. So if somebody really wants to have that neck pulled up tight, about as tight as you can get it, then that's the way to go. You can do that under IV sedation. I do that in a surgery center. Again, you'll have, surgery takes about 2 hours. You'll be in recovery room for about an hour to hour and a half. You'll be in some compression garments for a couple of weeks. Downtime, you're probably not going to be able to go to work. Depending upon what you do, the earliest you'd go back to work is about a week, week and a half. You won't be able to exercise for 3 weeks. So a little more downtime with the surgical procedures. So now we get into the age group where I'm into, where we have not a lot of fatty tissue here anymore. That's sort of resolved over time, or maybe you never had it, but you start seeing more neck laxity. So at that point, liposuction in any form isn't really going to help you much. We have tried to do just the laser lipo. We do get some skin tightening, but it may not be enough for somebody to really appreciate the difference. So at that point, I usually don't offer this device or standard liposuction, depending upon what their goals are. Maybe they just want a little bit of tightening. And so in my case, I just want a little bit of tightening. I want to see what the device can do, how tight I can get it with just non-surgical. And that might be fine for somebody, or somebody who doesn't have doesn't need or doesn't want the downtime for surgery, then this device would be offered. I think it's, again, a very good option. Again, it would be the same thing. Once a month for 3 months, limited to no downtime. Now we're talking about surgically though, neck lift, but a lot of times as you start getting into your mid to late 50s, neck lifts are really not much of an option. You have to go more towards the full facelift, which is an incision around the front of the ear, circling behind the ear and out along the hairline on both sides. And that was really what you're going to need if you want to do something surgically that's going to really tighten that up. Facelifts on average last about 6 to 8, 9 years. Again, you're going to have about 3 weeks of downtime before you can exercise, and roughly 2 weeks off of work, depending upon what you do. It could be longer if you have a very physical job. So as you can see, in the past, we basically had liposuction and any type of surgical procedure, whether that's neck lift or facelift. But nowadays, we have really good alternatives that patients can do and hold off surgery, or maybe would never even consider surgery. But now we have something that can help them get some results that they want, and actually very good results, limited downtime. And so that's what we have to offer today. So
when a patient comes in for a consultation, what do you consider?
So the big thing about the consultation, this is why I like to do it in person. So I like to talk to the patient, about what bothers them. They have to point it out and show me. I want them to sort of verbalize what bothers them, and then really get a sense of how much correction do they want. And I'll kind of show them, do you want this much, this much, this much? Because sometimes, again, in that younger crowd, you might just do some dermal fillers in the facial area, and then do virtue down here. So it really just depends on what their goals are. And then once I examine them, I can feel the texture of the skin. We can test the elasticity of the skin. I can kind of get a sense of how much fatty tissue that they have. And then from there, we can walk through what devices are available and what I think might be your best option. All right. Well, listen, I hope that helps bring out all of the new stuff that's out on the market today. If you have any other questions, we're happy to answer them for you. Give us a call, follow us on Facebook, visit our website. And I think in the next few months, we're going to be going over all of the latest technology that we have, again, other areas of the body that we can treat somewhat non-surgically or minimally invasive, just like we did today.